Okay, I'm going to sterilely suction my patient nasotracheally. So the first thing I want to make sure is I have my suction kit, which is a 14 French, typical size for an adult. I've got my SurgiLube, and I have my suction catheter. So make sure your suction catheter is on. I've got it set at 120 millimeters of mercury. So first I'm going to open my kit and take out my sterile gloves. So I'm going to open my sterile glove kit, not touching the gloves. But before I put my sterile gloves on, I need to put my SurgiLube onto my sterile field. So again, I'm going to just squeeze the SurgiLube out into my sterile field. Careful not to touch anything, not to touch the outside of the packet with the sterile field. Now, once I've applied that, I'm going to put my gloves on. So I'm going to grab my right glove, touching only the inside of the glove. Okay, so my right hand's on. Now I have a sterile hand. I can grab the cuff of my left hand. So I'm going to grab the cuff so I can touch the outside of the sterile glove, and I'm going to... So now, both of my hands are sterile. Now I'm going to pick up my suction catheter. Now once I picked up my suction catheter, this hand is no longer sterile. I'm going to pick up my suction tubing, making sure that I am able to hold both ends of it so it doesn't touch anything until I'm ready to suction. I'm going to attach my suction tubing to, my suction catheter to my suction tubing. Okay. And I'm going to lubricate the outside of my catheter. Again, my right hand is sterile. My patient is on a nasal cannula, so I'm going to pull the nasal cannula down so that it's still blowing in the patient's mouth. So they are getting some oxygen while I do this. I'm going to let the patient know what I'm going to do. I'm going to suction you. I'm going to advance this tubing down into your trachea to help remove secretions. It's going to feel a little bit uncomfortable. Just bear with me. So I'm going to slowly advance it down. And again, I'm careful not to touch her nose or anything else on her face, only the tubing. Slowly advancing it down until I feel resistance. And sometimes you may have to twist the tubing if you're not going all the way down. So I'm going to suction down until I feel resistance or a cough reflex. Once either of those happen, I apply suction and I suction back out. Okay, I'm going to let the patient have a few breaths and I'm going to assess if I need to suction again. So I feel like, yes, if I got a fair amount of secretions, I'm going to suction my patient again. So again, I'm going to lubricate my catheter. And I'm advancing my suction catheter down my patient, being careful not to touch her nose with my sterile hand. And again, you don't want to try to push too hard. If you're feeling resistance, try twisting the tubing or readjusting it, but don't press too hard because you can end up causing mucosal damage. All right, I feel resistance. I apply suction. And I suction back out. Now, I'm going to put her back, put the oxygen back on, and I assess my patient. So I'll monitor her heart rate, her respiratory rate, as well as her breath sound.